All right, we are on to the next topic, which is when to get an MRI.
Brought to you by Dr. Booth, Dr. Couples, Elevate Sports Performance and Healthcare.
Yep. So this is our Doc Talks. We're gonna have a couple of good talking points here for you to take away from. A little bit shorter, a little bit more condensed. So when to get an MRI. We've seen this actually in research. They did research and they showed that with the same findings of an MRI, we can have patients that are symptomatic, meaning they actually do have pain, discomfort, and then no symptoms, asymptomatic. So what's that mean for us as practitioners? The picture doesn't always dictate pain. Pain is something that is very multifactorial. There's lots of things that go into it. So if we get an MRI and they say that's what's causing the pain, we have to make sure that we prove that first with an examination and looking through some of that stuff. So there can be symptoms that are caused by some tissue damage, and that can be proven by MRI. But there's also the opposite, where you can have this picture say there's tissue damage, but there's no pain.
Yep. In fact, out of the people who do not have any pain, if you take imaging of those individuals, depending on the age group you're talking about, and this is true of many areas in the body, 30 to 80% of people can have some type of abnormal finding. And we've both worked with people who have had long-standing pain with squeaky clean MRIs. Mm-hmm. So it's very muddy unless you have other information available.
Yep.
And so we're going to now outline if you are someone who needs this MRI or who doesn't. And I think the first thing we should probably talk about is when don't you need an MRI? Because I think people jump to this way too fast, especially if you're someone with back trouble.
Mm-hmm. Yeah, so when don't you need it? In isolation, meaning just pain. So someone's coming to us with just pain. That is something where we try to do everything in our power before getting an MRI for that patient. So if someone comes to us and they've been experiencing back pain and they're like, well, do I need imaging? And say their back pain's been around for 2 weeks, 6 weeks, whatever the time frame is, we now kind of start a clock of, okay, we're going to start treating this patient for a given amount of time before we even think about doing imaging, because we want to give conservative care a shot. We want to give that conservative care a shot before we have to expose radiation. We don't want to take unnecessary imaging. We don't want to find those findings that could be detrimental to the patient, saying, oh, well, you have a disc bulge. There's a lot of people that have disc bulges and they don't have pain. So what will that tell the patient? They'll say, oh, well, I am damaged, and they'll start having this thought process of connecting themselves to that disc bulge because they think that they're now hurt. In isolation, if there's just pain, we can't jump to the conclusion that we need an MRI. We have to prove through examination and conservative care that it is something that we would have to get done.
And that's even if the pain is really bad. The extent and severity of pain doesn't always manifest with the extent and severity of tissue damage. A prime example of that is anytime you've gotten a paper cut.
Absolutely.
Hurts like the dickens. But last time I checked, you probably didn't go to the ER to get your paper cut checked out. You probably get laughed out of the ER, in fact, unless it was really bad paper cut. So small injury, substantial amount of pain. On the flip side, I'm sure we've all heard of someone getting injured in war, where they have a limb blown off, or we see it in the movies, and they don't report experiencing a whole lot of pain. And it's not that they're in shock, because they can still a lot of times do other things. So those two things, the intensity of pain and tissue damage, are not always synonymous things. And we have to be mindful of that when it comes to getting imaging.
Yep. So, long story short is just pain is not a good indicator for imaging. We want to extend or try to get other means of care before we look into other imaging. When do we need it, Zach? When is something that you would say, okay, that person immediately needs to get an X-ray, MRI.
Mm-hmm. So one of the most important times you want to get that is if there has been a traumatic event. That doesn't mean stubbing your toe and all of a sudden your foot hurts, although sometimes depending on the severity of the stuff. But if you suffered a major fall, if you were in a intense car accident, if you jumped off of something and landed weird, anything that is traumatic, you're in a game and someone hits your knee, and you swell up, might be a good time to get an MRI. That's probably one of the first times where we'll say, you got to get something looked at, because we want to make sure that there's nothing bad going on.
Yeah, it's a short time frame. Something happened. There was something that actually happened to your body. It wasn't this gradual onset of something, of a symptom or a pain. So something actually happened to you. You started immediately feeling symptoms or seeing symptoms. Definitely something that we would most of the time say you need to go get that imaged. In addition to that, if deficits start to present, deficits are meaning you can't start, can't use your hands, or you can't use your feet, or you're starting to not be able to feel certain things on your body. Those are something that, one, should be evaluated, and two, definitely most of the time we're going to get an image to see what's going on there as well. So if we have something that's declining in deficits, now patient's big toe can't move, now arm literally can't move, or hands can't move, those are things we're going to take very seriously, and we're going to make sure that those go out for imaging.
Yeah, and also often not talked about, but equally important too, is have you had any changes in your ability to go to the bathroom? So, are you wetting yourself, or you can't go anymore, or are you, losing bowel control? It might be embarrassing. I had a patient who wasn't telling anyone that he had some bladder deficits, and it's like, you got to get imaging. What's going on?
Yeah.
So those are times where we definitely say, we're not the person for you yet. Let's get this checked out to make sure that there's nothing seriously wrong.
Yeah. So deficits, those are big ones, and that is considered a deficit. You now do not have the function for that.
Yeah.
Red flag stuff, if you start to not have the ability to eat, you're feeling nauseous, you're feeling extremely fatigued, you're not feeling overall well, you start losing, did I say losing weight? I don't know if I said losing weight. Losing weight's a big one. Unexplained weight loss, having night sweats that are not normal to you. Those are all potential red flags that you should definitely get evaluated. Someone should ask you some questions about, and those could lead us towards also getting imaging done.
And a fever too would be another incident. If you have a fever that's unexplained and associated with the pain, you definitely want to get that checked out. And then the last thing we would say is if you've exhausted conservative measures and nothing's changed. And generally the rule of thumb that I've seen is if you go a month of conservative care and you've had nothing change. Mm-hmm. So it's the same pain or it's worse, and I mean nothing, like you had no changes in your ability to do activity, anything like that, that's another time where we think an MRI is probably warranted.
Yeah. All right, so we are now going to look at the need for MRI before care. Is that always something that you require as a doc here at Elevate?
Very rarely. The only time I will say that's the case is if it's someone post-surgical.
Yeah.
Because I need to know what has went on and also what the limits are. But we think we're good at what we do, but one thing we're not good at is changing how you look on the inside or your anatomy. And anatomical changes that are found on MRI are not how we help you get better. The way we help you get better is by increasing your ability to move, doing things to help you on the pain side, and building up your conditioning so you can get back to the activities that you love and want to do. And it's not changes in body structure. Changes in body structure take a long period of time. That's usually when we send you over to the gym side to build bigger muscles so you can get the biceps that Kyle's got.
So people come in and they'll say, well, I have this image. Of course, if you have imaging, you can bring it in and we can discuss what that means. But it is not an absolute necessity for what we need to do here, because again, we're looking at function in the presence of not having any of those other red flags, all those kind of scary stuff that we were talking about when you actually need imaging. The image is not, it's not needed, so we can move on with care. We can try to get you functioning at a higher level than you were when you first walked into our facility. So those are our recommendations on imaging and MRIs and the need and necessities for some of those things. So again, if you have any questions about that, or you want to talk about when to get some of those, when not to get some of those, if you need more extensive questions, reach out to us and we can give you our best knowledge on some of that stuff.
You could talk to myself, Dr. Booth, or any of our docs. 30 minutes for free. Yes, folks, by one of our discovery sessions. Give us a call at 702-558-2151, or check us out on the web, elevatesph.com. Hopefully we see you soon.
All right. We'll see you guys.